Was a study that came out that was pretty cool called the Predimed study. There was two of them. One was in 2013, 2018, and they wanted to see if the Mediterranean diet could prevent cardiovascular disease in high-risk adults. 7,447 participants in Spain, ages 55 to 80, so old, and they're also at higher cardiovascular risk just because they had more lifetime cholesterol exposure. They randomized them into three groups: Mediterranean diet plus extra virgin olive oil, Mediterranean diet plus McNuts, and the control group, which is just a low-fat diet. So, findings of the study: 30% reduction in major cardiovascular events, heart attack, stroke, death in both Mediterranean diet groups compared to the control. So both the olive oil and the nut Mediterranean diet group had 30% reduction in cardiovascular events. Benefits occurred without calorie restriction or weight loss. So didn't matter if they were eating too much, too little, not at all, didn't matter. It happened regardless because food quality was a lot better. This diet, specifically heart disease linked to inflammation, so this diet is highly anti-inflammatory because you're eating lots of anti-inflammatory foods, again, fruits, vegetables, olive oil, fish, that kind of stuff. There was a follow-up study on it. It's called the Predimed Plus. It was a follow-up study, went from 2013 to 2025, so I believe it incorporated that same study group. And then that goal was to explore whether adding calorie restriction and exercise to the Mediterranean diet enhances benefits. So doing what they did, but now with reaching calorie goals, did that make it a better diet? So this one had 4,750 participants with obesity and metabolic syndrome, no diabetes or heart disease, but that means they were probably on the cusp of it because they have metabolic syndrome. That's kind of a smorgasbord of issues that can potentially cause those things. This was two groups: the Mediterranean diet plus calorie restriction plus exercise plus weight loss support, which is a lot of things. And then they had the Mediterranean only diet. We already know the Mediterranean diet alone worked well from the previous study, so they used that as the control and they added extra stuff to it. With that, I'm assuming on the benefit they would have found with the Mediterranean diet, they also found with the weight loss and the calorie control diet an additional 31% lower risk of developing type 2 diabetes. Average weight loss of about 7.3 pounds or 3.3 kilograms, and then 1.4 inches in waist reduction, which is roughly 3.6 centimeters. Those were manifested within 6 months of following that diet. Those things happened, and they were maintained for 6 years. I don't know how long they were eating that way in the study. It looks like it was about 6 months or less. The enhanced version improved insulin sensitivity, reduced inflammation, and supported metabolic health, which makes sense because then you're cutting calories in addition to eating the healthier food. It also apparently showed lower incidence of type 2 diabetes, which we already knew, and certain cancers. They had better gut microbiome diversity, which I'm sure you've heard all about it. That's a good thing. And then it also increased life expectancy up to 13 years when adopted early in life.